I want to take this opportunity to reach out to the constituents of the first districts, individuals and families, to let them know that we appreciate their awareness of the current crisis. We know this is going to take adjustment of their personal lives, professional lives, and we stand by to work through the crisis of the coronavirus. I would like to thank Fred Hunter, the CEO at Desert Valley Hospital, for joining us this afternoon.
Thank you, Supervisor Lovingood, for inviting me here today. I think it's really important that we do spend our time together and try to share with our community everything that we are doing within the San Bernardino County in particular to protect all of our residents that live up here. Well, I'll say in the high desert, but I know that you have a big responsibility within the full county, but within our local hospitals as well. First and foremost, I think you made the comment about remaining calm, and I think that's very key here. You don't need to rush out and buy all the groceries and the toilet paper. I mean, I know there's a lot of jokes going on social media, but if you are asked to self-quarantine in your own home for 15 days, which is really what's being recommended by the CDC, yes, I understand you're going to have your personal needs that you're going to need to be able to meet, but I think that we all have friends and family, hopefully, that are there to help you should you not be able to leave your home. But it's really just about making sure, and I think that the whole key about self-quarantine is about, the term I'll use is flattening the curve. I think maybe we've all heard that on the news. And when you kind of think about exposure, if we have a lot of congestion going on at once, and that opportunity for exposure is going to occur in a peak, what we're trying to do is push that down. So people are not together as often, and people are going to be at home, separated from each other. And then we have that social distancing going on with the 6 feet, which is preferable and recommended at this point in time, all because if somebody should cough or sneeze, the droplets can make it about 6 feet, and let's just try to keep you from having to be exposed at that point in time. At the hospitals up here in the high desert, specifically Desert Valley Hospital, we this week really took a very aggressive stance under the recommendation of the Prime Healthcare Corporation on working in conjunction with them in all of our hospitals. But it's really about taking the CDC guidelines and creating a restriction to our visitation policy, which has really been so difficult for me to execute, because when you're in the hospital, you need your family there because that's part of the healing. And now when you restrict that family member, you're kind of changing that full dynamic. And I think that is not, it's not good, but I understand why we need to do it. So we'll keep it that way for the next, at least until the end of the month. We'll reassess where we are. We'll see where we are in the nation, of course, and see how our world is doing.
No, I appreciate that. Could you share and expand, if somebody suspects they're having symptoms, what action should they take?
That to me, it talks about, testing and when should they get tested?
Yes.
Should I get tested? I think it's really key here is over the next several weeks, we're going to start to see the number of diagnoses of COVID-19 rise.
Correct.
That's only going to be occurring because we're going to be testing more individuals. All right?
Right.
Does that make sense?
I understand.
I really want to make sure people understand that. In the hospital, we're going through a very strict protocol to make sure that the symptoms that an individual might be displaying do match up to the CDC guidelines as to a probability of an individual having COVID-19.
Right.
Coming in and saying, hey, can I get tested? No. We're still trying to limit that because there's not a whole lot of tests right now.
Correct.
The president is doing what he can with his own task force with the government and trying to get all that out, putting a lot of power within the state leadership to try to get those tests out to their populations.
To the communities. I understand that, but so again, let's just say a person with suspicions. I mean, at that point, your advice would be to call?
I would suggest first, is to call your primary care doctor.
Yes.
And say, hey, doctor, I visited one of those, I just traveled within the last 14 days.
I just came back from Washington. I came back from Seattle.
Or Italy, yeah, exactly. I'm having shortness of breath. I'm running a fever.
Right.
What would you like me to do? And the key here is, yeah, we want to get them into medical care with that type of scenario, which I
Yes.
think is very important. My preference would be is to have the primary care doctor see them in the office,
Okay.
test them in the office. If they don't need to be hospitalized, that's great.
Right.
Let them go home and self-quarantine.
Okay.
If they are really sick though, acutely ill, and they need to be in the hospital, absolutely refer them over to the emergency room.
Well, that's good to hear, because what I think the big thing that needs to be emphasized at this point is the fact that the test isn't readily available. It's not an option just to walk in and say, I'm kind of concerned, I'm worried, I was out last week. The tests are not readily available, and the tests are going to be reserved for those that are showing serious symptoms of being impacted potentially. And then once you're tested, how long is that delay going to be before I know the results?
We have seen the turnaround time to be about 24 to 48 hours at this point.
Okay, so we can expect a
Yes.
day to 2 days
Yes.
until we have a confirmation. And then at that point, at that point, if again we're being tested, the serious highlights, it looks suspiciously, is there a high probability the person would be hospitalized?
Just because you have COVID-19 does not mean you need to be in the hospital.
That's good to understand.
Exactly.
So it can be treated like a bad case of the influenza?
It can be, and that's where the doctor, if you are, see, oh, by the way, don't touch your face. That's the thing that's really key here. Wash your hands, don't touch your face. So, the patient, as long as they're not acutely ill, they could be diagnosed with COVID-19 after they've been tested. Again, but you got to get there to get the test.
Mm-hmm.
They could be discharged from the emergency room, sent home, self-quarantine.
Okay.
Okay? If they are acutely ill, the pneumonia is really impacting their body, they cannot breathe, and they need to be in the hospital, absolutely they'll be placed in the hospital.
I'll be a minute. Very good.
Yes.
That's good to know.
Yeah.
And I think there's value to this. On Fox News last night, Amy Driscoll, there's a news clip you can pull out. I'm going to estimate the lady was probably in her mid-40s, had contacted COVID-19, stayed at home, went through a recovery, and from a week later, it actually done. It's an interesting video because it demonstrates again with clarity a person contracting the disease, surviving, and still going about normally functioning in her house during that time. So I think that's an important thing to see. And myself, if we could somehow demonstrate more of those cases to the public, it'll give some assurance that, hey, it's okay for me to go home. It's okay for me to self-quarantine. And in 15 days, I'm going to be better. In a week, I'm going to be better.
That's right.
But I do think it's that we can address those that are potentially critically ill.
Yes.
And that we know there's a pathway in a hospital bed that they're going to receive services.
Absolutely. A lot of coordination occurring right now between all of healthcare industry
Yes.
throughout the state and throughout the country.
Absolutely. I want to take the time also to ask you to remain calm, do not panic, to stay in your home as much as possible, stay sheltered, stay with your family, and listen to and obey really the request as they come forward.